What if spine stiffness isn't happening in just one ligament, but on both the front and back of your spine at the same time? New research shows these changes aren't isolated. They're connected through collagen, connective tissue, and a condition called DISH. In the next 6 minutes, we're answering it directly. Are front and back spinal ligament changes truly connected in DISH syndrome? Welcome back to Diabetes Reversal. Today we're going deeper into how connective tissue and collagen changes affect the whole spine. Last time, we covered how high blood sugar stiffens collagen through AGs. Today, we ask, how far does that damage really spread? DISH, or Diffuse Idiopathic Skeletal Hyperostosis, is classically defined by flowing new bone along the front ligament of the spine. First described by Dr. Jacques Forestier in 1950 and later defined diagnostically by Dr. Donald Resnick, DISH targets that anterior ligament. But DISH rarely stays alone. Research now asks, does the same stiffening process also reach the ligaments running down the back? Behind the vertebral bodies runs the posterior longitudinal ligament, and when it hardens, doctors call this condition OPPL. Further back, the ligamentum flavum connects each vertebral arch. When this thickens and hardens, it's known as OLF. Even further back, the supraspinous and interspinous ligaments can ossify too, a lesser-known process called OSIL. Even further back, the supraspinous and interspinous ligaments can ossify too, a lesser-known process called OSIL. So the real question becomes, are these 4 separate problems, or one connected process affecting the entire spine at once? A multi-center study analyzing whole spine CT scans in DISH and OPLL patients set out to directly test this connection. The results were striking. The more severe a patient's DISH, the more likely they were to also have posterior ligament ossification. DISH severity showed a significant statistical correlation with ossification of the posterior longitudinal ligament in the neck. It also correlated strongly with ligamentum flavum ossification in the thoracic spine, the same region DISH affects most. The strongest link of all was with the interspinous and supraspinous ligaments, the deepest posterior structures of the spine. This tells us DISH isn't an isolated anterior problem. It's one signal of a whole spine tendency toward connective tissue stiffening. One shared driver is collagen glycation. Chronic high blood sugar stiffens ligament collagen throughout the spine, front and back like.
A second driver is insulin signaling itself, which can push ligament cells toward becoming bone-forming cells through an internal growth pathway.
Stiffened collagen creates microdamage that triggers repair, while insulin-driven cells actively build new bone. 2 paths, 1 result. In patients with neck-level OPPL, over half also showed OPPL lower in the spine, and most had ligamentum flavum involvement too. But the risks differ. Anterior DISH mainly causes stiffness and swallowing issues, while posterior ossification can compress the spinal cord. Warning signs include stiffness, but also numbness, tingling, or balance changes, signals the posterior spinal cord may be affected. Because both sides can be affected, doctors increasingly recommend whole spine imaging rather than checking just one area. At the center of it all sits diabetes, chronic hyperglycemia driving connective tissue change everywhere along the spine at once. Diabetes, obesity, insulin resistance, and age all raise the risk of this connected whole spine ligament stiffening process. This isn't sudden. It builds gradually over years of elevated blood sugar, which is why long-term diabetes management matters so much.
Consistent blood glucose control reduces new collagen glycation everywhere along the spine, not just in one isolated ligament.
The encouraging part is that this connected process can be slowed, and managing it starts with the same foundational steps. For diabetic patients with known DISH, doctors may recommend periodic screening to catch posterior ligament changes early.
I see, so this is the area?
Exactly, this is the posterior ligament. Physical therapy and regular movement help preserve flexibility and support healthier connective tissue throughout the spine.
Let's start with a gentle stretch. Okay, good. Now slowly twist to your right. Like this? Perfect.
When posterior ossification compresses the spinal cord, surgical decompression may become necessary to protect nerve function. Ongoing research into genetics and anti-age therapies aims to better predict and eventually slow this whole spine ossification process. To recap, DISH isn't isolated. Collagen glycation and insulin signaling connect anterior and posterior ligament stiffening across the whole spine. Thanks for watching Diabetes 2 Reversals. Subscribe and hit the bell so you never miss the science that could change your life.